I think, okay, we're there. We're live. Well, good afternoon, everyone. Welcome to another episode of Park Right Here with Tom Cosentino and Katrina. Katrina will be joining us a few minutes late. And generally, I'd like to start off the game that we have a contest to see how many times I go off tangent, which is usually about 5 or 7 times. But this conversation is a little more serious, so I'm going to try to stay focused, which is hard for me to do, to stay focused. But today we're going to talk about deep brain stimulation, or DBS. And with that, we have three people. Oh, I got to make a disclaimer. We all are volunteers with the Davis-Finning Foundation, as we're referred to as ambassadors. However, this does not represent Davis-Finning. Nothing we say here can be attributed to Davis-Finning. Matter of fact, every time they hear me talking about it, they just want to go like this because they're not sure what I'm going to say. So we're just going to try to have a good time. So what I want to do is introduce the three of us. We have Christina LaMonica, Doug Reed, and Joe. And Christy, if you'd like to start off by telling us, introducing yourself and giving us your quick story.
Hi, everybody. So I was diagnosed with Parkinson's in 2020, but I really have had symptoms since 2013. And I've had REM sleep disorder. Since 2006. I did stem cells. I worked with stem cells in grad school, and I started with doing cell work in my sleep. And my husband thought it was fun. That I was just funny that I would do science all 24 hours a day. Little did we know that it was REM sleep disorder, and I would end up with Parkinson's. So I had my DBS in May. May 14th was round 1, stage 1. Stage 2 was on May 23rd, which was way more painful than I could anticipate. And I've only been on for a week, so forgive my dyskinesia, friends, because I am still working on trying to figure out my meds and my everything, my settings. So yeah, it's going to take a little bit. I'm still hopeful it's going to be great. So thank you for having me today.
Oh, you're welcome. So Doug, tell us your little history.
Hi, everyone. I'm Doug Reed from Lafayette, Colorado. I was diagnosed with Parkinson's in 2010 when I was 36. I'm 50 now. I got DBS in the fall of 2019, and it has been life-changing for me. I was taking a lot of carbidopa, levodopa, and I was very dyskinetic. And now, for the past 4.5 years, I've just taken 2 selegiline a day.
That's awesome.
I am a DBS advocate.
Hey, Joe, so tell us about yourself and your DBS, because yours was particularly unique, wasn't it?
Yeah, it was kind of interesting. I was first of all, hi everybody.
Yeah.
So I started seeing symptoms in the late 90s, and things like not being as fast on the softball field, tripping and falling, things like that. And it took 5 years for a doctor to diagnose me. I was in my early 30s at the time. And in 2003, I got the diagnosis. And by 2011, I was taking 19 pills a day. It was ridiculous. And I was having all kinds of side effects and different things going on. So I decided to get DBS in 2011, and then I started to see the effects of the DBS wearing off, and I was in a wheelchair by 2017. And in 2017, 18, and parts of 19, I was in a wheelchair, and I was speaking in one-word sentences, and things were not going well. And I just thought it was a progression of the disease. I just thought this is what the disease is. Then my doctor moved away, and I needed to find another doctor, and I found a doctor actually closer to my house than my doctor was, and he started seeing me for 2 hours a visit, literally 2 hours a visit. And I was saying to him, how do you make money seeing me for 2 hours a visit? I can't be the only person who's seen 2 hours a visit. So I know, I feel like I can help you. So he started programming the device, and after 4 or 5 visits, I was out of the wheelchair, speaking in full sentences and having full conversations. And it was always like they set the clock back 10 years. It was amazing. So
Wow.
I'm an advocate of DBS as well, and I just tell everybody, you know, I mean, I never encourage people to get it done because it's brain surgery, very personal decision.
Yeah.
But I do say that programming is everything. It's really the key to the whole thing.
Well, something you said that was interesting about. Oh yeah. See, I've got to be. I don't have DBS. I've been diagnosed. It'll be 9 years in August, and fortunately, I still have minor tremors. That seems to be the gist of my Parkinson's, muscle stiffness and rigidity. But the whole idea of DBS scares the hell out of me. But that's why I wanted to sort of have this conversation for people who are considering it. Anybody consider focused ultrasound, or was that available at the time?
Yeah, it wasn't available.
When we talk about focused ultrasound, I feel very strongly about them. I think it's very misleading. What it is they say it's non-invasive, but it actually ablates the portion of your brain, so it destroys it. Which is you can't get things that you destroy back, right? So it's more dangerous than DBS. DBS can be removed if you need to.
Mm-hmm. And that's why Michael J. Fox. I'm sorry, Christy. That's why Michael J. Fox can't get DBS because he got
right.
Mm-hmm. Right. Well, my understanding is you get diagnosed with Parkinson's, they start you on the various drugs, including carbidopa, levodopa. After long-term use of the carbidopa, levodopa, that the dopamine builds up or some, and that leads to dyskinesia. And then in order to get rid of the dyskinesia, you have deep brain surgery. That's kind of the way I see it. It's just like this vicious circle. Is that how you guys see it as well?
That's kind of the way my path was. I was taking carbidopa, levodopa, and Comtan and Azilect.
Me too.
And a lot of pills, and I was very dyskinetic, and I had dystonia in my neck because I was shaking and turning, and the DBS cured all that.
I wasn't able to sleep. I wasn't able to sleep through the night. I was getting 2 hours of sleep a day. It was terrible, and I was falling. I said I was in a wheelchair. I wasn't able to talk in normal manner, and DBS took care of all of that.
Well, Doug, you mentioned that you took Comtan as well, and I have a great relationship. I'm a neurologist, and he started me on Comtan, and one of the side effects of it is it makes your urine really bright. I don't know if you've experienced that.
Yeah, if I was at all dehydrated, my urine would be the color of the orange part of a candy corn.
Yeah. Oh, absolutely. And because I have a great relationship, I actually started a journal about the color of my urine for like the next 3 weeks. And then when he asked me how it was going, I said, everything's fine. I mean, I appreciate the fact that I'm taking this now, but I'm not alone. I can't go into the public pools anymore and pee because everybody knows me. I try to use super humor to deal with my Parkinson's, but because I'm taking now I take 5 tablets a day of carbidopa, levodopa, and I take it every 3 hours. And I take Comtan or entacapone with that each time, plus a couple other little medications. But my doctor says I'm starting to show small bits of dyskinesia at this point.
Well, you'll know when the dyskinesia sets in full flare.
Oh, yeah.
I think we lost Christy.
Yeah.
Yeah. Let's hope she can jump back on. There was one of the other ambassadors when I first started learning about dyskinesia. She doesn't take any medication for it. And one day I called her up and said, "Do you mind if I ask you some questions? Like, does it hurt?" And because going the flailing back and forth, and it's like, no, it doesn't hurt. It's just more bothersome than anything else. And it seems to me my doctor asked me, "Well, you got to balance here. What do you prefer, tremors or or dyskinesia? Because I can treat one or the other, but I can't really treat both.
Yeah, my dyskinesia was so severe it would make me sweat. And my doctor contemplated putting me on medication to cure sweating. And I thought, one more pill.
Oh, wow.
But when I got my DBS, it was motivation from the Davis Finney website. I watched a webinar with Dr. Kara Beasley, who is on the medical advisory board for the Finney Foundation. And she practices at Boulder Community Hospital, which is 8 miles from my front door. So I
Oh,
thought,
wow, that's great.
I'll take the leap. And Dr. Beasley's methodology for DBS just made sense to me. She does it in 3 procedures.
Right.
And she did them each a month apart. Right brain, left brain, generator implantation. And then a week later, my DBS was activated.
Yeah, my doctor did the same. You know, first it was the leads, then it was the battery charger, and then it was the programming. So, but
and
you know,
some neurosurgeons are doing it all in one procedure and doing it while the patient is asleep.
right.
And
Well, they do it with MRIs now. When I got mine done, there was no MRIs associated with it. And actually, you made me think of something. There were, when I was recovering from surgery, the Medtronic rep came in and said to me, "You know, you're lucky you had Dr. Osme do your surgery because they placed the lead in the wrong spot, and he took it out and replaced it in the right spot." And most doctors wouldn't do that. Most doctors would just let it sit there and try and fix it with programming. And I was like, Christy's backstage. Yeah. So I was like, wow. I mean,
Yep, I'm going to go let her in. I was on.
Yeah.
So I'm trying to, here, let's see. I got to figure out how to get back to there. You guys keep talking. I'll figure this out.
No, so it was
Here we
just,
go.
it was so shocking to me that they would.
And let's see.
Gone again. There she is again. Oh, well. Nope.
Okay, I seem to be having some buffering issues on my side. Crap. Don't go anywhere. Guys, keep talking.
Doug, did you have the honeymoon phase when you got yours?
So apologize. I seem to be buffering.
No,
a bit.
I didn't experience that.
Yeah, that was like a month and a half of where I felt like I didn't have Parkinson's, and then it kind of went back to where it was, and that's kind of why they waited a month for me to get my programming done.
Once my system was activated and I was fully programmed, I feel like sometimes I feel like I don't have Parkinson's.
Yeah.
I twitch now, which I didn't used to.
Mm-hmm.
And I don't know if that's from the DBS or progression of the disease, but I've met people before and they, and I asked them, do you notice anything wrong with me? And they say, well, I thought you had Tourette's.
Right.
For my twitching.
Right.
But
I spent the first 10 or 15 years I had the disease with people not knowing that I had the disease. And now everybody knows. And it's still sort of, I mean, it's been 23 years that I've been diagnosed. And before that, it was probably another 6-7 years that I had it. It's interesting, my wedding pictures are 7 years before diagnosis, and my hand already looked like this.
Your story is pretty remarkable, Joe. I had no idea that you were wheelchair bound prior to DBS.
Yeah, I was in a wheelchair for 2.5 years or so.
Wow.
Yeah.
And now you can walk.
Yeah, I walk like 2 miles a day, and
Fantastic.
Isn't that why Samantha is so like, she's so adamant that everyone finds the right programmer. She is very adamant about them.
Yeah, I brought her to a couple of my appointments with Dr. Fazil. Dr. Fazil was the doctor who helped me so much. He lives in the Seattle area now. For anybody who was watching this, lives in the Seattle area. I could not recommend Dr. Arash Fazil any higher or any more than I am. He's just the best. But yeah, Sam came to my programming a couple of times, and she was startled by when the program that the electricity washes through your body, and it's freaky when you're not used to it. It's freaky.
Yeah, every time I shut my system off and then turn it back on, when I turn it on, I just feel a wave of energy flow from my head down to my toes.
Yeah.
Sometimes it makes me a little nauseous, but only for a few seconds.
It makes me tired when I adjusted. It makes me. I just didn't need a nap for like 20 minutes. That's right.
Last Wednesday when we came home, first of all, we had to turn down my system right away, and I couldn't do it because I was so dyskinetic. Because once we got in the car, it was really bad. Like I got granola bar all over our car. None of it got in my mouth really. My husband wanted to bring me back to the hospital, but I told him, no, just go home. I want to take a nap. And so we got home. I needed him to turn my system down, and you can watch me calm down. It was so crazy watching it.
When did you get it done?
I was turned on last week, and I got stage 1 was both leads on the 14th of May.
Okay.
And I was asleep for mine, which is probably different than both of yours. You can see these marks on my head. This is just it wasn't really. It was a smaller halo for the CAT scans that they did when I was in the operating room. Right place.
Attaching the head frame was by far the most painful part of the procedure for me.
I was truly asleep for that, so I did not know anything.
I was awake, and they gave me no painkiller, and so I had the same little scars that you were showing, Christy.
Oh wow!
I had mine, and I said to my wife, "They're not drilling into my head. It's not a big deal." And she could see the blood coming out of my things I couldn't see. So I just thought it was the pressure from the thing, but I didn't realize they're actually drilling into the skull. I didn't even know that.
I co-lead a DBS support group for Parkinson's Association of the Rockies. And so I've heard a lot of people's stories about DBS. And I think finding a good programmer is key.
Yeah.
For me, it only took about 6 months for my programming to get dialed in to the point where I wasn't dyskinetic, I wasn't tremoring. But I've heard stories of the programming taking up to 2 years. And granted, it all varies on how often you can get in to see your movement disorder specialist and or your programmer.
I mean, I didn't even know that it would be possible to get the thing programmed better than it was. I thought my doctor was great, and she's a good doctor. And I don't mean to disparage her, but the way she was programming me just wasn't working. When Dr. Fazil came in, he it takes, when you get programmed the first time, it takes a while for it to settle in. It takes like a couple hours for it to settle in. Then it takes a couple of days for it to really find its level in your system. And then even then you still have some time to wait for it to become stable.
He has to heal it too.
Yeah.
Yeah, one of our fellow ambassadors, Patty Burnett, who lives in Colorado, she got DBS recently, and she was telling me that when she goes in for a programming session, she'll get programmed, and then she tells her doctor, all right, I'm going to take 15 minutes to a half an hour, and I'm going to walk around the hospital and see how the programming affects me.
Mhm.
And I thought that was brilliant.
Yeah.
I've had programming done before where I think I'm good. I'll walk out of the hospital and I'll get to my car and I'll be tremoring and I'll just revert back to the old program.
Right.
It was on.
Does the programming, is that dependent upon which type of device you have, or is it pretty much the same?
They all work pretty much the same. It's just I switched from Medtronic to Boston Scientific because Boston Scientific has had a better way of separating out the left and right sides of the brain.
Okay.
So that was a big factor in me getting Boston Scientific. Now I have a Boston Scientific generator / battery, and I have Medtronic leads in my head.
Oh, wow.
But now Medtronic has come out and they've improved their system greatly with internet access and things like that. So
Joe, do you have a rechargeable battery or non-rechargeable?
rechargeable.
Okay,
What do you have?
non-rechargeable.
Which one, Medtronic?
Yeah, I wanted just in case the technology improved, it's held in the battery, right?
Yeah.
So the closed loop system is in the battery already for Medtronic.
Mhm.
But what if they improve?
Right.
I don't think insurance would let me change my battery for that. So
Well, the insurance is caught up with that. Like they gave me a hard time about changing the battery the first time. I had a non-rechargeable battery to begin with,
oh,
and it died 4 years after the first one, after it was first installed.
Shoot.
And the second one died 4 years after that, and then the third time when it got done, I switched to the Boston Scientific.
How difficult is it to replace the battery?
It was a 12-minute surgery. You put on, they slice you open here. They slip the thing on, they make the connections, and they reset it up.
No Velcro
to you guys.
or
So my surgery here, this was the portion that hurt the most, was putting the battery.
Hmm.
Mine is right here.
My neurosurgeon said she wished there was such a thing as a skin zipper.
Yeah.
Yeah, that would be like Velcro.
Unzip and reach in and
Doug, do you have a rechargeable or no?
I have a rechargeable, yeah.
Yeah.
Is that like a little thing you wear around your neck that hangs onto your chest?
Yeah, I've got mine right here. Hold on.
How long does it take to recharge?
It takes me about an hour. I do it once a week.
Okay.
So it takes
1
me
hour once a week?
1 hour once a week. Yes.
I charge about every 4 weeks, and it takes 3 to 4 hours usually.
And you just wear that around your neck for 3 to 4 hours?
Yeah, I tuck it into my shirt, and I'll just sit on the couch and watch a movie. I've been on road trips, or
It doesn't have a cord. You plug that in and it charges your battery, and then you wear it around your neck.
yeah. So
It's a hockey puck.
this, if I can get it out. This is the charging unit,
Okay.
and it nests in a recharger that plugs into the wall.
It looks like my iPhone charger.
Right.
And it beeps. And when it finds the generator, it stops beeping.
And then
Okay.
when it's fully charged, it beeps twice.
Yeah.
It goes
But
So-
the yoke, as I call it, that the charger goes into, has a counterweight.
Okay.
And so it just rests around your neck. It's pretty
That's cool.
simple procedure to charge.
Hey, Christy, since you're the most recent one, was there any discussion about AI in conjunction with your programming?
No, not yet. We didn't discuss that. My programming's done by my MDS, who we get along great. I message him all the time, and he's very responsive. And so I don't really feel any issues with that, but we didn't really talk about AI that much. in programming. But there is, with Medtronic, there is this system right now. There's a brain sense that you can turn it on and you can see how my brainwaves look at the moment. You can listen to the neurons and they tell you what's going on. And so you know when you need to like kind of level it out. So I think that's probably kind of AI-ish, right?
There's an app, Christy, with the Medtronic device, or is
My
it?
my MDS has that portion. So
We can program you remotely.
I only live 20 minutes from the hospital, so it's not worth it for me.
Only the Abbott device can be programmed remotely.
Yeah, they can, I think.
Isn't I thought all of them really they had some capability for that.
Boston Scientific definitely does not have
I
it.
have my charter, my phone thing, my chest thing. Words. Sorry. My husband's going to grab everything that I can control myself with. It's pretty cool.
I kind of like the idea about AI if it's ever applicable, so that it can make those micro adjustments and not have to worry about constantly changing your program.
No, we can get my Medtronic stuff. So that's what the closed loop system is. It listens and adjusts based on like what's going on in your brain at that moment.
Do any of you guys have any regrets doing this, or had you wish it had been done differently, or anything along those lines?
I have no regrets whatsoever.
Good.
I had regrets when I was in the wheelchair. I thought to myself, well, that didn't work, and all I did was speed up my progression. But now that I'm stable and reprogrammed, I have no regrets.
Well, that's what I hear from most people. Very few people seem not to be happy with the process, but I guess with anything, it's not 100% perfect.
Right.
It takes time too. You know, you can't be discouraged that your programming takes time.
Yeah.
It's like everyone needs someone to tell them that, listen, slow yourself down, relax, it takes time.
Yeah.
It can't be perfect right away.
It's a good attitude, Christy.
Yeah.
I mean, it's not, right? It's, you know, I have to be realistic. I want it to be perfect right away, but it's not. So,
especially since the doctors say we don't really know why this works.
right.
Yeah.
That works. That's really concerning when they tell you that.
I mean,
But it works.
When I got mine done, we called it casual brain surgery because I had Lyme disease that summer. Maybe I didn't have Parkinson's, maybe it was the Lyme disease. But I wound up curing the Lyme disease, and I saw the Parkinson's. So the doctor called me and he said, "We can get you in tomorrow. We never get up the room. You want to do it tomorrow?" And I was like,
God.
Okay. And we got in the car. We brought my daughter to my mother's house, and we got in the car and we went and got brain surgery that day. It was
That's amazing.
It was crazy. Yeah.
I got a lot of stuff at work. I waited till the end of the semester, the spring semester, to get it done. I teach, and I didn't have to go to any of the graduation stuff like that because brain surgery kind of was more important.
Yeah.
So.
Yeah, the recovery was pretty easy.
Yeah,
for me at least.
Yeah.
The 2 brain surgeries, I spent one night in the hospital. Both were done on a Friday, and I was home before noon on the following Saturday.
Wow.
Me too.
Does anybody say to you it's just brain surgery? That old expression?
Yes.
So this is the controllers, or the controller. This controls my this links up to my chest, to the battery, and this is my therapy. So I can hold on.
The white and blue thing hooks up to your chest?
What?
White and
This
blue thing?
connects.
Okay.
And this controls the current to my brain.
So you have to hold the white thing up to your generator?
It's fine. No, where it is close enough. I can have it on a table, and as long as it's like in the same area as me. And then this controls my brain, which which I'm not going to change my settings, obviously.
No,
No.
yeah, I had the same thing as Dory had.
Yeah. This is a cell phone. I just want to feel like I belong.
Here's a sheep.
This is my controller.
I was
I'll see your sheep and raise you this for a moment, just for some levity.
Are you sure it's okay to wash this shirt? You've only worn it for a couple of days.
There you go.
yeah.
We're talking serious stuff here. We need a little second levity.
Mine has a right and left side control, so if I feel like I'm tremoring more on my right, I can up the current. If I get too much current, I'll get dyskinetic and wiggly, and
Right.
so I can dial it down.
Yeah.
We
So
think we
you're-
understand the medication derived. So I'm not really playing with my controls until it sets in, until we know what's going on.
Right.
So you can micro adjust them on your own as well?
Yeah.
I went to a Parkinson's expo a couple months back, and when the lady stood up, the doctor asked her to stand up, and she went up to the front of this on the stage and had her daughter handed her daughter the remote, if you will, and she turned it off. And within seconds, you could see her becoming like stiff as a tree. And then the daughter turned it back on, and she came back to life. It was amazing watching how quickly that the system, the DBS surgery, how quickly it made a change in her symptoms.
Right. Michelle Lane used to do that as a party trick.
There you go.
At the Pan forums, she would turn her DBS off, and she'd be like freaking out, and then she turned it back on. She'd be fine.
That's funny. I can see her doing that. You know, I've had the chance, and maybe you guys as well, to speak on behalf of the Michael J. Fox Foundation. We met via Zoom meet with our congressional congresswoman and state and U.S. senators, and the whole thing was revolved around telling them your life story so they can have an idea of how.
In 3 minutes, right?
Pardon me?
In 3 minutes?
I had 5 minutes.
Oh.
But what I did was I said I'd like to be last. So at the end, I said, you've heard their stories. My story isn't that much different, but this is what I want to show you. And someone had sent me a picture of the x-ray of their brain where you can see the leads, you can see the staple marks.
Yep.
And I showed them the picture. I said, this is what I want you to take away from this meeting. Not the fact that I have Parkinson's, not that, I lost my job, etc. But this is to cure the Parkinson's at this point when you get dyskinesia. And if you have anyone, your colleagues who aren't in favor of this bill, just please, for God's sake, show them the picture of this video or this DBS skull and ask them, how can they not support that?
Mm. Mm.
Right.
I always went last when we would go up on Capitol Hill with Michael J. Fox Foundation, and I went last because I always cried whenever I talked to the congressman. Cory Booker must be the biggest crybaby in the world, because I always cry when I see him.
Oh, I like him.
Mm.
Well, it was interesting with my Parkinson's. I was never much of a crier. My mother says we don't have the crying gene.
Right.
With the Parkinson's, it affected me on that emotional level, and I started taking a mood enhancing pill, which sort of stopped me from crying. I would just think about it, and next thing I know, I was just crying.
Yeah.
I cry frequently, and with the Olympics coming up, I know I'm going to be a crybaby.
Okay, so you have to expand on that. What does the Olympics have to do with you crying?
I don't know. I just find joy out of athletes competing, and it makes me very emotional.
Did you cry at Toy Story 3?
Probably. I cry at commercials for toilet paper. I cry every time I see a person in the military who comes home and sees the surprises
Their dogs?
kids.
Oh, if they see their dogs, I'm like, game over. If it's an animal, I'm done. Toast. I cry. Not people. If they die in like TV shows or movies, it's got to be an animal makes me cry right away. If it's a dog or a cat.
Oh,
But-
God.
Yeah, no. Not.
Yeah, sometimes I get sucked in emotionally, and I try not to.
What was the mood drug they put you on, Tom?
It's called lamontagine.
What's that?
If I'm pronounced right, lamontagine.
That's Lexapro.
No, it's separate. I take Lexapro. Here, then give me a second.
Lamotrigine.
Yes, that's it. So what was interesting, where I go, my neurologist is with the University of Maryland, and in the same setup, they have a psychiatrist that works with the Parkinson's patients. So they it's more of a holistic approach. And so one day I was talking to my neurologist. He goes, "What do you want to change?" I said, "I want to change the fact that I cry all the time. I know there's nothing wrong with it, but Clint Eastwood doesn't cry, John Wayne doesn't cry. I'm not going to cry." It was my edit. But so she put me on that drug, and I initially Googled the drug, and it was for people with bipolar or epilepsy. And I sent her, I cut and pasted that and sent a note back to her saying, "I'm not taking this." And I love her response was, "Well, I give you such a low dosage, I feel comfortable giving it to pregnant women." And of course, I want to be silly, so I reply back saying, "Thank you for that information. Should I ever become pregnant, I'll know I can continue to take the medication."
That's
And her response was, why am I not surprised? But that's for me, for better or worse, I try to use humor to deal with all this stuff that we're going through.
Humor is the key.
right.
So I got to share with you guys that my Parkinson's joke for when we were going in front of talking to the senators and Congress people. It kind of goes like this. A congressperson who voted against the National Act to End Parkinson's was asked to come to a local support group meeting. There was a large population of older people, so he felt like he had to go. So as he was getting ready to go to the room, he's a little nervous because he's not sure what the response is going to be. He opens the door, he looks in and looks to his aide and says, "I think it's okay. They're all waving to us."
That's fine.
I don't know if you know, Joe, do you know a guy named Mason from Michael J. Fox?
Mason, yeah.
He's the one that told me I couldn't say the joke.
Oh, yeah.
He goes, we want to make friends of them, not enemies. Yeah, but it's so funny on so many different levels.
Yeah. My family and friends refer to my Parkinson's as progressively debilitating neurological disorder. It's more fun to say it that way.
Yeah. Well, I found that when I moved out here, I'm somewhat fortunate too. It's been 9 years. And I don't really show a lot of physical symptoms, but we started playing pickleball, and I never really wanted to tell people I had Parkinson's because I didn't want to be seen as the guy with Parkinson's. Right. But after I got to know them a little bit, and I was kind of telling them, what's going on, etc. And about a month ago, I made a really bad shot. I mean, I just made the worst shot of my life. And one of the players on the other yelled at me, goes, "Tom, don't blame it on the Parkinson's. You just suck."
Yeah.
And at that moment, I knew there was acceptance. It was I just felt really comfortable.
Right. A friend of mine, you probably know him, John Ball from Los Angeles. He was always with the Michael J. Fox Foundation and the PAM Forum. And so John runs marathons. He's like almost 80 years old and he runs marathons. Wow. And so I saw him in the halls of Congress one day and I had to ask him a question. The question was, "Where's this office?" But I said to him, "Hey, can I ask you a question?" He goes, "So you want to run your first marathon?" And I said, "No." And he goes, "What do you have, Parkinson's disease?" And I was like, never mind. I mean, here's a guy who's 30, 40 years older than me, and he's running marathons. He's had Parkinson's since 1950 something.
Wow.
It's incredible. He's an animal.
Does he have DBS?
No, I don't think he does. Wow. Yeah.
I went to a Parkinson's symposium through the University of Maryland a couple of years ago, and I had a table, but I noticed a lot of people weren't coming to the table because there was just so much to choose from. So I went into the auditorium, and when they were starting to have their break, I would just run around and put information on everybody's table, say, "Take a look at this, take a look at this." And then one of the people who was running it came up to me and said, "We really prefer that vendors don't do that. Just keep your stuff outside." I said, "Well, I'm sorry, but I have short-term memory issues because I have Parkinson's. I don't remember you saying that." And she looks at me with that look. She goes, "You can't use that excuse here. Everybody has Parkinson's." How about if I just ask for forgiveness rather than permission? She goes, "That's a better response."
It's good of you, Tom.
Well, I look at what we do here, and I give everybody in this group respect for the fact that they're advocating on behalf of Parkinson's. And we all do it in our own special way, whether it's like just letting people know you have Parkinson's and, giving, sort of educating them. I've had, since my diagnosis, I've unfortunately had 2 back surgeries and a hip replacement. And every time I went into the hospital, when the nurse came in, I said, okay, sit down. I need 5 minutes of your time.
Yeah.
I'm teaching you about Parkinson's and how it how it impacts your patient, how important it is to make sure that you give their medication on a regular basis. And I don't let them leave until I actually I mean, they can start leaving. I'm like, wait, don't make me chase after you. Because it's easier. I like to tell them it's easier to do as I ask than not, because I'm going to follow you. And we're going to have this conversation.
Right. It amazes me that I was in the hospital to get my battery changed. One of the times I had the battery changed. And the nurse comes in and goes, okay, you have Parkinson's. What is that exactly? And I'm like,
no way.
I'm like, are you kidding me? In the year 20, whatever it is, you want to know a Parkinson? And this is the hospital that I got the thing done in?
How did you get into school? Like, that's scary.
I have no idea. I have no idea.
That's scary.
Yeah.
You
I
know,
was taking my meds in the bottles to hospital for my overnight on my first surgery. And it was like a struggle getting them to let me take my meds.
Yeah.
My husband had to be like, take this as a sign off, and he gave me my meds. She's like, well, we can get your inhaler, then breathe it. I'm like, no, you can't. You don't have that. Like, trust me, I know. I struggled with finding where you get this stuff. And they got the wrong carbidopa, levodopa, and anyways from the pharmacy. So,
you know, I took, when I had the second back surgery, I had her sneak in all the meds for me just to be on the safe side. And then sure enough, even after speaking to the director of the pharmacy at the hospital, they were missing 2 of my meds. So I basically gave them the meds that I brought with me, and they had the audacity to charge me for those for the meds. For my own medication. But the fun part was, after I got released and we drove home, it was like an hour drive, I realized I never picked up my meds. So I called the floor nurse and said, I'm sorry, you guys have my meds. Can you please have them shipped to me? And she goes, well, we don't do that. You need to come and get them. I'm like, you don't understand. I just had back surgery. I had to bring my own meds in. And you're telling me that you're not going to ship them back to me? I have to come get them? I said, I understand your position, but can I just get your name, please? She goes, why do you want my name? Because I said, when I call the CEO of the hospital, I want to make sure he knows who I was talking to. So basically, do you want to send my meds? And do you need me to make that phone call? And they shipped me my meds.
Good for you, Tom.
I call it in something simple, because I love to advocate, but I like to make things simple for people. I call it the George Costanza theory. Because we all know who George Costanza is. And if you ask yourself, if you're in a situation, you just simply say, what would George do? Mm-hmm. George allow that floor nurse to have him make him come back and give him the meds? Absolutely not. Yeah. And for me, especially as you get older, I think some people are more afraid to discuss or to contradict their doctors or such, because whatever reason. But it's this easy thing. What would George do? And if George wouldn't do that, why should you do it? It's just a simple concept.
You wouldn't want George to do that. I mean, you won't have him like calling every day, right? Yeah. And coming back.
Because I say, for family and friends, I have no shame when it comes to family and friends. I'll do anything, no shame whatsoever.
Chris, I'm sorry.
I say that's one of I think my better qualities, but some people don't really think it's a good quality.
I was going to say, Chrissy, they obviously shaved your head.
Yes.
Doug, did they shave your head?
3 times. I even got my head shaved when they put the generator in.
And did they bill you $400 for that haircut?
I don't know. I had phenomenal insurance.
Me too.
I heard.
So, Chrissy, I have a challenge for you. In your post, take a picture of your head once a week for the next X amount, and so we can document the hair growth.
It's already grown a lot since like surgery.
Or if you're really feeling like a challenge, rub some chia seeds up in there, and see if you can become a living chia head.
Right. No. I want to be. I already have my Halloween costume picked out. 11 things. I have the pink dress downstairs. I need to buy the Eggo waffles, and I'm all set because I have the head shaved. Mm-hmm. I might as well use it for something, right?
What are you gonna do?
11 from Stranger Things.
Oh.
Have you seen it?
Yeah.
Okay.
I haven't seen
You
Stranger
look
Things.
a little like her.
What are you showing us, Joe?
Oh, you're
stars.
The staples in my head.
Oh, I can see that now. Wow. Now, do you guys have any issues going through airport security?
I have none whatsoever.
You can walk through the scanner with your
Yeah, both the scanner that rotates and metal detectors.
Yeah.
Oh wow.
My system doesn't.
Does anybody stop you and say, "What's that in your chest or in your head?"
Yeah. I tell them just to avoid any conversation. I say I have a pacemaker.
You have a pacemaker.
And they go in, they feel that, and then they give me the wand down, and that's it. I've never had a problem.
Ever since I had the hip surgery, whenever I go through, the hip surgery throws me out. I have to go get patted down. And I find it very apologetic. I'm sorry, sir, but we have to do this. And I know it's just your job. Just go ahead and do it. Get it done. You know, it's hip surgery. I'm not carrying anything. But I was just wondering how the DBS worked with the airlines.
The DBS is fine for the airlines, but I just don't want to screw around.
The manufacturer will give you it looks like a credit card.
Yeah.
Okay.
About the same size, and it describes what you have in you. And I bring that with me, but I've never had to show that to anyone.
Now, does changing weather patterns have any effect? Like if it's too cold or too hot?
Nope.
Okay.
Hormones. I need time to sit on the computer and look this up to see if hormones impact it. Who knows? Because I would like to, because it impacts medication. So does it impact how well my meds work if they work with my DBS? I don't know. Yeah.
Right. Chrissy, be careful with coming off your medicine. Don't do it too soon.
Oh yeah, don't yeah. Thank you. I did cut down by like half, but the amounts I'm taking are it's still too much. But I go off very frequently. But I don't want to turn off my DBS because then I end up more disconnected.
Yeah.
Well, I understand that the two of you have to be leaving soon for another commitment. So I'll just say, let's just kind of wrap it up, and I'll just go around the room once for parting thoughts. Joe, what are your parting thoughts?
My parting thoughts are really look into it. Find a doctor that you're completely comfortable with. They'll talk to you. They'll listen to you. They'll take time to spend with you, and programming is the most important thing. There's no substitute for good programming.
That's good. Doug, what about you? Parting thoughts?
I second that. Just you got to take your time with the programming, and don't be afraid to ask questions.
Just remember, George Costanza would ask questions.
Don't be afraid to request a long appointment with your programmer.
Yeah.
And don't be afraid of the procedure.
Well, that's me right there. I'm hoping that I don't have to have it, but the idea of it just scares the living hell out of me. But hearing people such as yourself makes it a little bit easier to process. Well, Christy, since you were the last one to have it, what are your parting thoughts for all of this?
I am grateful to be in such great company as Joe and Doug and take their advice for everything. Because
you got me.
Yeah, you're pretty tough. Come on, you have your hip replaced, right?
I've had that and 2 back surgeries.
It's safer to get DBS according to the Finney article than it is to get your joint replaced.
Well, my hip only took me an hour.
But you could. It's dangerous.
Yeah.
And if anybody is interested, I'm documenting everything that has happened with my story on Caring Bridge. If you just look me up, you can find me.
Okay, just Google your name and find it.
Yep. Right.
Cool. I'd love to see that.
It's on Caring Bridge. So
Great.
you can see that I get more disconnect than this. It's pretty scary.
What I want to say in the end then is the fact I want to congratulate and commend the 3 of you. I know it's not easy to sit here and just basically strip yourself for the audience of how this impacts your life leading up to it. But I just want to say thank you, all of you. It's been great, and you've got nothing but my respect.
Thank you, Tom.
Thank you.
Thank you, Tom.
Cool. All right, well then, folks, it's been a pleasure. We'll talk as soon as we get this put up. I'll send you a link to it so you can look at it.
Thank you.
Sounds good.
Great. Well, have a great day. Thanks for doing this, guys. See you, Joe.
See you later, Bugs.
Bye-bye.
Thanks, Joe.
Take care, Tom.
Peace out.
Yes.
Thanks for
Bye,
the
Tom.
opportunity.
Thanks, Doug.